Hi, my name is Beth Leinbach. I'm a PGY5 fellow in psychosomatic medicine, and I've been working here at Montefiore for a little over 4 years. So for me, residency was such a good experience that it seemed like a good reason to do fellowship here as well. I think the number one thing that I like about Montefiore is the people. I really like all the residents who I worked with, as well as now my co-fellows. They really emphasized when I was going through the whole process of figuring out where to go for residency and where to go for fellowship, they really did emphasize education, and that has been absolutely true. That the focus has been very much on learning from each particular case. What I'm doing this year is psychosomatic medicine, which is consult liaison psychiatry. Currently, I'm working on the transplant team, so I'm doing a lot of psychiatric evaluations of patients who are candidates for liver transplantation or heart transplantation or LVADs. My favorite rotation was psychosomatic medicine, consult liaison psychiatry, because I like that you get to be involved with the medical teams and you get to interface with them, and also I think it's like a great way to learn about other fields, as well as to be really helpful to the teams who are taking care of the patients on the inpatient services. We offer a different perspective, and I think that we really help both the medical team and the patients. Montefiore as a whole sends residents to Uganda. It's not just the psychiatry program, but also internal medicine, sends people, pediatrics sends people, family medicine sends people over. So it's a very well-established relationship that we have with a hospital there in Kasoro, Uganda. So I decided to go because it just sounded like a great opportunity to see psychiatry in another setting. I would say that overall the faculty here are very collegial. They're all very nice, which was very much in contrast to in medical school. I remember in medical school being a little bit, intimidated or afraid of some of the attendings, and it was such a contrast to come here. And from the beginning, I just felt like I was respected, as they wanted to get my opinion on cases and on patients. And that was from right off the bat from intern year. Obviously they had a lot to teach me, but they always wanted to get my point of view and respected that. And that's been something that I've seen throughout. I live on 86th Street on the Upper East Side, and I take the subway to work every day. I've always done that the whole time I've been in residency, and it's been really easy. What's nice is it's a reverse commute, so you always get a seat on the subway, and you just sit on the same train for 30 minutes or so. So door to door for me is 40 minutes.